डॉक्टर अंजलि, आपका स्वागत है। तो सबसे पहले मैं आपसे ये जानना चाहता हूँ, हम फॉर्मल अपने डिस्कशन के ऊपर आए, बहुत सारे कम लोग हैं जो ये लाइफस्टाइल मेडिसिन, लाइफस्टाइल डिजीजेस, इनके बारे में आजकल तो बात करने लग गए हैं, लेकिन पास्ट में ऐसे 10 साल पहले की बात नहीं करता था। तो माय क्वेश्चन इज दिस, विच थिंग मोटिवेटेड यू टू डिस्कस, टू शेयर दिस नॉलेज, टू लर्न दिस नॉलेज? वो क्या फैक्टर्स थे जो आप ये जो लाइफस्टाइल मेडिसिन है इसके लिए आपने स्टडी शुरू, और फिर ये स्टडी के द्वारा आपने अपने पेशेंट्स, अपने लोगों के साथ वो नॉलेज शेयर करनी शुरू?
Okay, so this is while I was doing medicine also, तो मुझे लगता था कि हम मेडिसिन तो दे रहे हैं, बट देर आर सो मेनी अदर फैक्टर्स जो कि इम्पोर्टेंट हैं. आई हैव ऑलवेज बीन अवेयर ऑफ द फैक्ट कि खाने में बहुत कुछ चीजें हैं जो हम गलत खाते हैं, जो आई सॉ मेरी फैमिली में, रिलेटिव्स में दिक्कत हो रही थी. बट and I could identify कि ये, हाँ, ये खाने की वजह से है. Patients में I used to see. So eventually I tried to learn more and more about nutrition, exercise, whatever courses, whatever information, whatever books, anything that I got, I started reading. This led me to a conference at Harvard, जो Institute of Lifestyle Medicine की conference होती है वहाँ हर साल. I went there, realized कि जो मैं इतने सालों से कर रही हूँ उसको एक नाम दिया गया है, लाइफस्टाइल मेडिसिन. So I went on to take a certification in lifestyle medicine. There is a international board of lifestyle medicine, and in Western countries, UK, USA, lifestyle medicine is a specialty which has become very popular. And it is not limited कि कौन सी स्पेशलिटी लाइफ, कौन सा स्पेशलिस्ट लाइफस्टाइल मेडिसिन करेगा. प्राइमरी केयर फिजिशियन भी करते हैं, एंडोक्रिनोलॉजिस्ट भी करते हैं, न्यूरोलॉजिस्ट भी करते हैं. सब स्पेशलिटीज में ये काम आती है. एंड आजकल जितनी गाइडलाइंस आती हैं, दे आर ऑल बेसिकली, फर्स्ट चैप्टर इज the first part of the guidelines of any chronic disease is lifestyle modifications. So this, and then we have an Indian Society of Lifestyle Medicine, and so I became a member. Eventually, for 2 years, I was the secretary of the society, and the society is doing a lot of work to make people aware and to make doctors aware. This is a very important upcoming specialty, and we should all start learning and practicing it.
मेरा खुद के इंटरेस्ट के थ्रू और बहुत सारे हमारे साथ में दोस्त जुड़े हैं और बातें हमारे YouTube पे.
आपका वॉल्यूम
राइट नाउ माय वॉल्यूम इज ओके, थोड़ा सा ओके,
या बेटर.
बहुत सारे लोग जो है वो बाद में जुड़ेंगे, हमारे चैनल को देखेंगे, क्योंकि बहुत सारे क्वेश्चन ऐसे आ सकते हैं, तो उनके बिहाफ की और खुद मेरा एक इंटरेस्ट है. मैंने इंडियन सोसाइटी फॉर लाइफस्टाइल मेडिसिन के बारे में बहुत कम सुना, तो आप थोड़ा सा हमें इसके बारे में अगर बताएंगे तो हमारे लिए, इस डॉक्टर्स के लिए या बाकी जो दर्शक हैं जो डॉक्टर्स नहीं है, तो उनको इसका बहुत फायदा मिलेगा. क्या क्या एक्टिविटीज होती है, कौन इसको ज्वाइन कर सकता है, कौन कौन से कोर्सेज यहाँ पे होते हैं, ब्रीफ में अगर डॉक्टर अंजलि आप बता सकते हैं.
Yeah, I was planning to tell this later, but yeah, I'll tell now. So as of now, membership जो है Indian Society of Lifestyle Medicine की, वो एलोपैथिक डॉक्टर्स के लिए ओपन है. It is also open for dietitians. It is open for clinical psychologists and exercise physiologists. So, but that is from the membership point of view. The initiatives for going to the masses, telling people also what is people who cannot be members or who are the public at large, उनके लिए भी initiatives होते हैं. Doctors के लिए भी we have every month we have some educational initiative. So it is a lot of efforts are being done. And we want to create awareness, and we want to make people adopt these lifestyle modifications so that we can decrease the load of non-communicable diseases or lifestyle diseases from India. because India means 70% of the diseases are non-communicable or lifestyle diseases. And we also, government is also trying to take a lot of initiative. And the Indian Society of Lifestyle Medicine is also trying to collaborate with the government to help the government also and to help people at large to manage this situation. And it is much more than lifestyle medicine is actually much more than being disease free. There is another element of not just being disease free, but being in a healthy state, wellness होनी चाहिए, mental and physical health के अलावा emotional health भी focus करते हैं हम lifestyle medicine.
तो डॉक्टर अंजलि, हम 2.5 साल से शायद यही काम कर रहे हैं और हमारे टीचर या डॉक्टर बन चुके होंगे, क्योंकि हम भी सभी बातें ये करते हैं। लाइफ से डिजीज से फ्री होना नहीं है, WHO बोलता है। लाइफ का मतलब है लाइफ को फुली, हैप्पीली और कंप्लीटली आप कैसे एंजॉय कर सकते हो, जी सकते हो, एंड दैट इंक्लूड्स द मेंटल हेल्थ, स्पिरिचुअल हेल्थ, सोशल हेल्थ आल्सो। तो ओवर टू यू डॉक्टर अंजलि, आज का टॉपिक है स्ट्रेस एज ए ब्लाइंड स्पॉट। After the session, we will have the question of the session, and after that, meditation.
Sure. So, like you said earlier, stress is something which हम लोग day to day कितनी बार बोलते हैं stress हो गया. We are always saying that we are stressed out. But what exactly is stress? According to WHO, stress is any type of change that causes physical, emotional, or psychological strain. Also, it is also defined as stress occurs when pressure exceeds your perceived ability to cope. So, blind spot is something that we all know what it is. It's an area which escapes vision. Even the human eye has a blind spot. We also see blind spots when we are driving. हमारे rear view mirror से पूरा area नहीं दिखता है, and we have some blind spot areas there. Recognizing stress itself can be a blind spot. The relationship between stress, emotions, and disease is often overlooked, and these are blind spots for many people. And like you said earlier, we can overcome these blind spots. The second eye covers up for the blind spot in nature. And we can train ourselves to drive better to overcome the blind spots on the road. But what about our own stress blind spots? To understand that, first we need to understand what is stress, what are the types of stress, what is the impact on our physical and mental health, स्ट्रेस और डिजीज का क्या रिलेशनशिप है, और क्या मैकेनिज्म है कि स्ट्रेस जब होता है तो हमारी बॉडी में क्या होता है. That will help us to understand how we can manage stress in the long term. Stress comes from the Latin word strictus, which means compressed. The French modified it to distress or distress in English, which is exactly what we mean when we talk of stress. But stress is not always distress. So Walter Cannon, a physiologist, described in the early 20th century fight or flight response, which is what we relate with stress. We'll talk about that later. Hans Sale, father of stress research, said non-specific response of the body to any demand is stress. And he said there's an alarm stage, there's an adaptive stage, and if there is adaptation doesn't occur, then there is an exhaustion stage. A few years later, Richard Lazarus described stress as resulting from an imbalance between perceived external or internal demands and the perceived personal and social resources to deal with them. Now, according to him, stress can be because of psychological factors, and that there is a personal variation in perceiving, coping, and managing stress. एक same stressful situation 4 लोगों में 4 तरह के impact करेगी, depending on what is their mental makeup and how their experiences have been in the past. So types of stress are many. Stress and stress is a part of our daily life. It has to be a part of our daily life. There cannot be कि कुछ भी सब कुछ स्मूथ चल रहा है, कुछ चेंज नहीं है, जो आप चाहते हो वो हो रहा है, दैट वो होता नहीं है. So use stress is positive and constructive and is beneficial for us. Like एग्जाम से पहले एक स्टूडेंट को थोड़ा स्ट्रेस हो रहा है, बट वो अगर थोड़ा स्ट्रेस है तो वो उसको बेटर फोकस करने में हेल्प करेगा. It will actually help him perform better in the exam. Stress reactions can also be useful if we get an infection. A little bit of stress reaction helps to mobilize our immune system also. And that is helpful. But distress is when a person is unable to cope with the stressor. Like when the student is so much under stress that unable to cope with the pressure of the exam and cannot perform to his optimal ability. उसको जो आता है वो भी वो भूल जाता है. So when stress is short-lived or one can cope with it swiftly, it is acute stress. आया, थोड़ी देर में manage किया और चला गया. Like if you're driving and somebody comes very close to you and you're thinking of an accident होने वाला है, or suddenly things are sorted out. So that stress came, it has gone, and soon after the danger has subsided, the recovery starts. That is acute stress. Or if any problem comes and you're able to solve it immediately or within a short span of time, that is acute stress. Chronic stress is when the same or different stressors occur repeatedly and the recovery between the two episodes is incomplete. Chronic stress can cause a lot of wear and tear to the body. We'll come to that later. Stress can be physical. For example, an illness, injury, exposure to extreme environments, even high levels of noise and pollution can cause physical stress. Psychological stress is caused by internal perception of the situation. Loss of loved one, loss of job, financial stress, work stress. All these can lead to psychological stresses. And today's fast-paced life has multiple stressors, which can lead to chronic stress. Example, you get up late because you were preparing for an important meeting late night. You get stuck in a traffic jam. You reach late for the meeting. Your boss gets angry with you. And meanwhile, while you're in the meeting, you receive a call from the school that your child is sick. Please come and pick up your child. You try, and then you have an argument with your spouse कि आप लेने जा रहे हो या मैं लेने जा रहा हूं because I'm in an important meeting. So this kind of cascade goes on and on some days. So an incidence of stress is supposed to be higher in medical professionals because of the long working hours and professional demands. So how often do we encounter these kind of scenarios? Arguments with people, running around. So what are the causes of stress? They can be stress at home, work stress, social stress, financial stress, stress with your relationships with others. These are the external stresses. Then there are the internal stresses. A lot of us do negative self-talk. We have pessimistic thinking. We criticize ourselves. We overanalyze situations. We have negative mindsets, unrealistic expectations, irrational personal opinions, all or none thinking, exaggeration and rigid thinking. So all these things, all these are sometimes our own doing, and we are creating stress for ourselves. Then there are the new age stressors. Social media is one. Especially excessive use of social media has been known to be associated with depression. Constantly being on the phone, constant connectivity, emails, other platforms, all this increases stress levels. FOMO, fear of missing out. Evolving technologies. We must keep up to date with our specialities and work, because we must move faster and faster just to even maintain our places, let alone for progress. Personal image has become very important for some people, and it causes a lot of stress. And constant work stress, which has become worse during COVID, because there is no demarcation between home and office. There are some developmental perspectives also. Genetics and environment interact to determine the response to stress. Some gene variations in the gene related to serotonin, our feel-good hormone, make people vulnerable to anxiety, depression, and poor coping with stressful situations. However, genes can predispose, but they don't predetermine, according to an expert, Gabor Mate. There are ways to decrease the impact of genes, like Dr. Sandeep said, switch on and switch off of the genes. It is possible for the stress genes also. Childhood and adolescence are also vulnerable stages when positive and negative experiences have a strong impact on how the child develops coping skills. Even a small negative experience during childhood or adolescence can make people very vulnerable to how they respond to stress later in life. During the first years of life, both positive and negative experiences can change the brain. Abnormal sensitization of the stress response in childhood can also lead to increased incidence of obesity and prediabetes at a younger age, along with many other lifestyle diseases. So stress is an overwhelming feeling of lack of control over our environment, and we are unable to change these. Stress is pervasive, persistent, insidious. Because it stems more from psychological reasons than physical threats. It is normal up to a point. It's a problem when it interferes with the tasks of daily lives, health, or optimal performance. How does stress manifest in terms of symptoms and signs? It can be physical, mental, behavioral, and emotional. Physical can be headache, acidity, digestive issues, palpitations, high blood pressure, muscular pains. Mental symptoms can be lack of concentration, memory lapses, difficulty in making decisions, confusion, panic attacks. Behavioral manifestations can be appetite changes, eating disorders, addictions, restlessness, fidgeting. And emotional, a depression, impatience, anger, tearfulness, personal negligence, procrastinating, avoiding others. So acute stress can happen multiple times a day, and we are usually aware of it. But chronic stress, which is more common, we may not even realize that we are under chronic stress, and it harms our health all the time. So chronic stress can lead to exhaustion, emotional, physical, and mental. Inability to perform optimally happens. And chronic stress leads to insulin resistance, neuronal changes, atherosclerosis, and inflammation. And this is the link between the stress and disease. This is a blind spot that can be missed by many patients and physicians. We keep on looking for treatments for high blood pressure, for example. We keep on looking for a treatment, giving tablets. But until and unless we have actually checked with the patient, was there any stress which started it? What are you doing about it? How can we help you to mitigate it? All these things are important. Just giving tablets is not sufficient. Not just for hypertension, heart disease, diabetes. There are a lot of these diseases where we should be checking for the element of stress. So these are some of the diseases. Majorly, these are the diseases which are linked with stress, but there are many more. Heart disease, asthma, weight gain, diabetes, immune system diseases like autoimmune diseases, which are very much on the rise, irritable bowel syndrome, addictions, dementia, some cancers, allergies, sleep disorders, depression, headaches, migraine, all these are linked to stress. An example of stress as an immediate cause of disease is Takotsubo cardiomyopathy, which is a rare disease. It's also called broken heart syndrome or stress cardiomyopathy. It develops in response to intense physical or emotional experience, and it remodels the main chamber of the heart. The main chamber expands and takes the shape of Takotsubo, which is an ancient pitcher which was used by Japanese to catch octopuses. It responds to treatment if diagnosed early, immediately. It responds to treatment but takes weeks and months for the recovery. In fact, according to data, 60 to 80% of primary care physician visits are related to stress directly or indirectly. The number of GP appointments for physical symptoms driven by stress-related mental illness in United Kingdom in 2019 showed chest pain, circulatory issues, and gastrointestinal issues were the top three in the list to be linked with stress. So managing stress effectively is important for decreasing the incidence of many diseases. But to be able to manage stress, we must understand how it happens. During stress, an area of the brain called hypothalamus is stimulated. I won't go into the details, but this stimulation cascades to stimulation of a small gland on top of the kidneys called the adrenal gland. This is called the HPA axis. This causes release of stress hormones like cortisol, adrenaline, and some inflammatory markers. And this is the fight or flight response. So some of the symptoms some of the things that happen physiologically in the fight or flight response are dryness of mouth, the pupils dilate, one starts breathing rapidly and it's a shallow breathing, the heart starts beating faster and harder, the digestive system becomes sluggish, the muscles become more tense, the blood pressure increases, the blood vessels to the skin constrict, and the skin becomes cold and clammy. All this happens through the sympathetic nervous system. We also have a parasympathetic nervous system which takes care of the recovery process. It decreases the heart rate, breathing rate, relaxes the muscles, and activates the digestion, the so-called rest and digest response. Parasympathetic and sympathetic system are part of the autonomic nervous system, which is that part of the nervous system which takes care of our physiological processes and our body processes. So chronic release of stress transmitters and hormones leads to insulin resistance, inflammation, and it can lead to changes in the structure of the brain, including emotion center and the prefrontal cortex, which is responsible for memory, logical thinking, and other higher functions. It also causes hormonal imbalances, inflammation, and alters our immune system, which can lead to autoimmune diseases or even recovery from infections and some other diseases. So the triad of stress affects the nervous, endocrine, and immune systems of the body. So managing stress is important, but it's a skill which can be learned and which varies from person to person. So broadly, we must look ways to decrease stressful situations if possible, change our reaction to stress if we cannot change the stressful situation, and improve our coping skills to deal with the stress. These are some of the common tools for managing stress. This is not an exhaustive list, but these are the common tools. So various breathing techniques are helpful and can be done anywhere. Deep and slow breathing causes relaxation. As in the fight or flight response, it was rapid and shallow breathing. So when we start breathing deeply and slowly, it calms us down. Various types of pranayama are very effective because of this reason. Relaxation techniques like progressive muscle relaxation, imagery, autogenic training, meditation can be practiced regularly, and they have long-term benefits. Changing our thoughts, oneself, or with cognitive behavior therapy with a professional can be done. Another effective way is to practice mindfulness. Mindfulness is being in the moment, being present where you are, and focusing on what you're doing. Mindfulness can be done at any time. You can eat mindfully, you can walk mindfully, you can breathe mindfully, and then there are some more advanced mindful practices. But mindfulness goes a long way in helping us to relax. Time management, sharing with others, laughter therapy, music therapy, learning coping skills and problem solving skills, they're all helpful. But most important is to take care of yourself. What you eat, how much you exercise, how well do you sleep, what is your support system, do you have any addictions? All these are the basics of learning to manage stress. For example, sugar and processed foods can lead to inflammation throughout the body and brain, which may contribute to mood disorders, including anxiety and depression. When we are feeling stressed or depressed, it's often processed foods that we reach for as a quick pick-me-up. But these foods cause further damage to the cells in the brain. Recently, we are also learning about the relationship with gut bacteria, which is a bidirectional relationship. The gut microbiota may play a role in the stress response and vice versa. The gut microbiota are about 10 trillion organisms inside our gut, which have a very important role to play in how our bodily functions happen. In fact, serotonin, the feel-good hormone, is released more from the stress. 70 to 80% is released more from the gut than the brain. Lack of vitamin B12, omega-3 fatty acids, and some other nutrients can also alter the stress response. Excessive fats, aerated and energy drinks, artificial sweeteners, trans fats, all these can lead to insomnia, anxiety, irritability, damage to our neurons, and impair our response to stress. So what works? A whole food plant-based diet, plenty of fruits and vegetables, unprocessed foods and grains, plant proteins, fermented foods, and healthy fats as nuts and seeds. Exercise is very important. It reduces the levels of body stress hormones such as adrenaline and cortisol, and releases some others as endorphins and anandamide. Cardio exercises are very helpful. Yoga is helpful. Resistance training has also been found to be helpful. And breathing exercises, of course, we've talked about it earlier. The amount of exercise, any exercise is good, but the recommendations that we give is 150 minutes of moderate intensity exercise every week. And that holds for optimal stress management also. Sleep and stress also have a bidirectional relationship. Poor sleep is significantly associated with elevated levels of stress. It makes changes in the emotion center of the brain. And when we haven't slept well, our stress response alters. We become more moody. And of course, we eat more food, which in turn leads to a heightened stress response. Stress, on the other hand, is the most common reason for insomnia. Social support has been described as support accessible to an individual through social ties with other individuals. It could be family, it could be groups, it could be friends, or the larger community. And people who feel more connected to others have lower levels of anxiety and depression. They have better emotional regulation skills. They have better coping skills. They are more resilient when facing a stressful situation. However, the social connectedness on the social media paradoxically has been connected to anxiety and depression, as I mentioned earlier. Emotional health. It's not just about being disease-free. It's about being in a good emotional space. And people who have meaning and purpose are likely to manifest less likely to manifest stress-related reactions. Tools like gratitude diary, happiness diary, working on one's strength, and other positive psychology tools are helpful. So now it's time to identify your blind spots. What are the things that you are not realizing that are stressing you out in your day-to-day routine? I would like you to answer these questions, and it will be helpful. Identify the stressors in your life. Just identify top 2 stressors in your life. Note them down. And think, what reactions happened when those stressors happened? Note them down and see how often they are happening, which sometimes you may not even realize that you were stressed about this particular thing. The reaction was just happening. Think of a recent illness which could have been stress related. Think of it, maybe your blood pressure shot up one day and you just went to the doctor, my blood pressure is shot up. You got a tablet and that's it. But what was the reason that it shot up that day? There was some stress which happened or something else caused it. Think of a time when stress impaired your ability to do your best. How did stress interfere? This is food for thought. Recall a recent situation when you could cope by emotion-focused coping or problem-focused coping. That gives us insights to what are our strengths, which way can we learn to manage our stressors better. So stress is not an illness, but chronic stress can cause illness. Recognize the warning signs. Reduce stress by taking care of yourself, prioritizing and organizing, improving emotional intelligence, and breaking bad habits. When you're in a flight, you're always told, put your oxygen first before you help others. So you have to be looking after yourself, whether you're a physician or in any profession. If you want to help others, you have to first take care of yourself. Identify the stressors, check what you can control, do what you love and enjoy, and manage your time well. Everybody seems to be running out of time these days, but there are still 24 hours in a day, and we need to work in that time frame. So follow a healthy lifestyle to begin with, and so I've already mentioned about the Indian Society of Lifestyle Medicine, and please log on to the website and see what the society is doing.